At Rivers Edge Family Medicine, we strive to provide a comfortable and high-quality healthcare experience for our diverse group of patients. As a front office staff member, you will be both the face and the voice of our company, and your decisions and choice of wording will often determine how patients view the practice. Let's explore some phone etiquette to help you be successful and supportive while navigating patient calls. When patients receive a phone call from Rivers Edge Family Medicine, it is essential that they immediately understand who is calling. Always identify yourself and the company first, enunciating clearly and slowly to make sure you can be understood. Practice using your pitch, tone, and inflection to communicate efficiently. Professionalism is essential to maintain throughout the phone conversations with patients. Keep in mind that a patient could overhear your words if you made an error in placing them on hold, if your voice carries loudly to a neighboring staff member, or through the check-in window. Always maintain HIPAA compliance with patient information and ensure proper consent has been granted for receiving phone calls or leaving voicemails. As a Rivers Edge Family Medicine employee, you will receive regular training on HIPAA compliance as it relates to patient phone calls and records, so you can maintain patient privacy and protect sensitive health information in accordance with federal laws. When speaking with a patient to schedule an appointment, there are general steps to follow and important details to check during the call. You should always confirm the patient's name and date of birth. Review any flags, notes, and emergency contacts. Check if the patient is due for their annual wellness visit. Remind the patient to arrive 10 to 15 minutes early for their appointment with their ID and insurance card. And reinforce the 5-minute grace period and no-show policy. Making sure that each patient is early and prepared for their appointments keeps the office schedule running smoothly and minimizes patient frustration in relation to rescheduling and no-show fees. In times of high call volume, you will often need to place patients on hold and handle calls in the order in which they are received. There may also be times when you need to consult another staff member or retrieve information in order to answer a patient's question. Follow these guidelines to successfully manage this process. 1. Ask the patient to hold. Always communicate clearly before disconnecting so they are prepared to begin waiting. 2. If placing multiple patients on hold, write down the patient's name and corresponding line so that patients are not repeatedly asked to provide their name or repeat their questions. 3. Resolve tasks or seek answers promptly and efficiently to avoid excessive wait times. While the majority of phone calls you receive will be easy to field, you could speak with a patient who becomes upset or is having an emergency. It's important to be prepared to de-escalate conflict and to respond to a patient who could be in danger. Let's go over the most effective ways to respond to a patient in distress. When you sense that a patient is becoming frustrated, do your best to stay calm. Remain diplomatic and polite, even if the patient becomes demanding or makes rude comments. You never know what someone else is going through. Always communicate your willingness to help resolve the problem or conflict and convey that their concerns are important. Kindness can go a long way. If you can't solve the problem yourself, it is okay to place the caller on hold to seek information or to let the caller know that you will need to consult with a provider and return their call. It is better to delay getting an answer than to give inaccurate information. Stay organized and punctual, responding to the patient promptly once you are able to resolve the problem. In rare cases, when a patient becomes extremely upset, you may need to end the call yourself. If a patient is yelling or cursing, calmly tell them you're ending the call and someone will be in touch to follow up with them soon. Let's discuss some other challenging scenarios you could encounter. If a patient is demanding to talk to management, place them on hold and fill in the office manager before you transfer the call. You may be directed to transfer the call directly or to take a message in those instances. If a patient wants to talk to management because they are not happy about their prescription denial or they want a dosage or other medication change, take a message. No one can change the prescription except the provider, so you will need to consult with the provider directly. In any of these scenarios, document your complete conversation within the electronic medical record. Also, document any messages you leave a patient so that we have a consistent record. Detailed documentation of these interactions ensures that the manager or provider assisting in resolving the issue has all of the information they need to move forward, and also protects the employee by demonstrating that the incident was handled with professionalism. On rare occasions, you may speak with a patient who expresses that they could be in immediate danger. In these situations, it is important to act quickly. If the patient expresses that they are having an acute onset of chest pain, shortness of breath, or feels physically endangered by another or likely to harm themselves, direct them to hang up and call 911 right away. After the call ends, talk to the patient's provider immediately so they can follow up to ensure patient safety. Document the entire conversation in the electronic medical record. If a concerning call is disconnected by the patient before resolution, consult the office manager right away to decide next steps to ensure patient safety. After relaying time-sensitive information and following directions from the provider or office manager, be sure to thoroughly document your conversation in the electronic medical record. That's a lot to keep in mind, so let's summarize what we've talked about. To be successful in fielding phone calls, you will always ID yourself and maintain professionalism. Maintain HIPAA compliance with patient information. Follow important procedures for scheduling appointments. Use courtesy, organization, and time management when placing patients on hold. Remain calm and supportive when patients become frustrated. Act decisively when a patient could be in danger. And thoroughly document your communications with the electronic medical record. Keeping all of these phone etiquette guidelines in mind will help keep our patients happy and healthy and our daily office routines running smoothly. We are so grateful to have you on the River's Edge Family Medicine team, and we know that you will have a great impact on our professional community.